back to the Nebraska Farm Bureau Podcast on all things rural mental health. I'm Reece Taylor.
I'm Carter Buell.
I'm Macy Bearnson.
And I'm Trey Anthony.
Today our guest is Jessica Slingsby, who is a psychiatrist. Hi, Jessica. To start us off, will you just give us a rundown of your job?
So I'm a family and psychiatric mental health nurse practitioner. So I started out as a registered nurse. I worked, my primary was working in, at Good Samaritan Hospital, but I also worked in the Rock County Hospital as an RN covering the emergency room. And then I went back to school for my master's degree with the intent of going back to a rural area. So with that, at the time, University of Nebraska Medical Center was offering both a family nurse practitioner in addition to a psychiatric nurse practitioner where you can be dual certified. So I went back to school and I'm dual certified in both family and family psychiatric mental health, which basically means I can see patients across the age span from 0 to 100 or however old I need to. And then most of my role is I provide medication management, prescribing medications with the specialty of psychiatry, treating a variety of mental health concerns such as substance abuse, depression, anxiety, bipolar disorder, schizophrenia, psychosis, ADHD, just a variety of, we also do some geriatric medication management, which is a requirement for anybody prescribed an antidepressant or psychotropic medication in the nursing home setting, is that they see either a psychiatrist or a psychiatric nurse practitioner. So we provide medication management for that. I primarily work out of Richard Young in Kearney, which we do a fair amount of telehealth, similar to how I'm meeting you today, where it's a Zoom call. We do telehealth into Region 4, which is where Bassett is at, and Norfolk and South Sioux City. And then I do come up to Bassett once a month in person. That's been a relatively new thing that I've done for the last probably year and a half, and see clients there. And in addition to my practice at Richard Young, and then I also have a practice in where I see clients once a month in the Grand Island Public School System through their Student Wellness Center.
Are there any specific issues that are more prevalent in rural areas opposed to others?
Some of the bigger challenges in the rural area is access to psychiatric mental health medication management, also access for kids to some of the services, such as there's some services such as multi-system therapy, which is where a therapist comes into the home at least every day. Those services are really limited in the rural areas. So when you are working with clients that require that level of care, that is definitely a barrier, especially if it's, I wouldn't quote it, but roughly when we've made those referrals, it's been about a 60-mile radius outside of like Lincoln, Omaha, Grand Island, Hastings, and Kearney, which really limits areas in north central Nebraska and even into southern Nebraska. So that's a limitation. In addition, sometimes any of this like group therapies such as IOP, which is intensive outpatient treatment for substance use treatment, can be somewhat limited in numbers for our substance use clients.
What role do you think technology plays in accessing mental health resources?
technology has and continues to play a huge role in accessing mental health resources. Like I said before, we do a lot of telehealth. Telehealth has been a huge it's certainly been a blessing for clients that live in rural areas to be able to come into an appointment without, for example, if I see a teenager, instead of them taking an entire morning or an entire day off of school to come drive 60, 70 miles to Kearney to come see me, they're able to log in, be able to see me in between class or at the school, and then go back to their class, also providing access to our clients that don't have the financial resources to make a trip to Kearney or Grand Island for gas or whatever that is. Also being able to do, and I know Richard Young has done some of this, also being able to do some telehealth consults with some of our family practice providers, and being able to connect with them, see patients, to be able to assess the appropriate level of care before having to make a lengthy drive has been huge.
What are specific issues you are seeing in rural mental health compared to mental health in suburban and urban areas?
Probably some of the bigger issues affecting people in rural areas as opposed to urban areas is really being able to have providers and services that understand some of the challenges that they have. Also understanding some of the systems in place. For example, we work out of, we are associated very closely with CHI in Omaha, which has been a blessing because we have access to a lot of different services with that partnership. But when we are talking about different services and things that we provide, even out of Kearney, which is not something I necessarily consider being rural, but in their eyes, in Omaha and Lincoln, they definitely look at that as being a little bit more rural. But there's different, discussions that they have. Like we were talking about telehealth and how to get people access to services. And their answer is, you can just call 911. And they said, well, that's not really true, because when you call for an ambulance in a rural area, it's their neighbors, it's a volunteer squad, those kinds of things. And their distance to travel for services is a lot more. Like I said, telehealth has really helped that. Also just an understanding of their, and this is a personal opinion I will share, but just an understanding of the things that are important in their way of life. We talk about a lot of our rural areas, hunting and fishing are really big pastimes and things that people really enjoy. But when you talk about that on a mental health perspective, we really start talking about the interest of not limiting their contact with guns. But if that's one of their main hobbies and activities, I think you assess that a little bit differently.
What strategies would you recommend to reduce the stigma around mental health and get people to open up?
One of the things, and I think we've really tried to do this, that's helped a lot, has been when you integrate mental health providers into the primary care setting, I think that really helps increase access. And they've done a lot. And just having people talk about their experiences seeing a mental health provider, even in our therapist, helps a lot. Like, people's personal experiences, that it wasn't scary. Also, those discussions that we treat all sorts of mental health concerns, like a variety of conditions and concerns. And that idea of people being, peers or consumers being able to come out and really talk about like their experiences, like that, especially if they've struggled with what we call severe and persistent mental illnesses, and their ability to, especially when they're integrated in the community and doing well. I think that's a huge something that greatly decreases those barriers for people to realize that, they struggle with the same things and there's some commonality among all of us.
In your experience, what strategies are most effective in addressing mental health issues?
Strategies that I use is really in addressing some mental health concerns are utilizing telehealth, trying to promote that patients can utilize telehealth for those discussions. You can log in anywhere. Also, when I'm in my office or trying to be fairly conversational, sharing, not making it feel like somebody is really, I don't want to use the word stiff, but so unapproachable. Just trying to be very and helping patients express what their experience is, and also explaining what my role is in that. Some other examples of some things that I do, like in my office in Kearney, like I have a box of Legos where my kids, the kids that I see can come play with Legos. They color, they can do whatever they, feel most comfortable with.
Why do you think there's a stigma surrounding mental health in rural areas?
I think some of that is that, and I grew up obviously in Bassett in the community that you're, coming from. And I have a true love of rural America. Some of the things that make it great make it also a little bit difficult to access mental health. Part of it is that, in my view, the folks in rural areas are hardworking. They work hard. They keep, they have jobs. They are farmers or ranchers, and a lot of that comes with some pride in the work that you do, but also some of that is that older stigma of we just didn't talk about our problems, those things. So that can be a little bit challenging to break through. Also, some of our past treatments, especially if they had family members that had to go to a psychiatric hospital, those experiences historically were really portrayed as being a little bit scary. People were hospitalized for months at those times. Involuntary commitments were, those length of stays looked a lot longer. Now, from an inpatient psychiatric perspective, our inpatient stays are anywhere from 3 to 5 days on average. So I think some of those things have ingrained some ideas into people's heads, giving it a stigma. And some of it is just a lack of those resources being in the area, and people having to travel so far made it somewhat, I don't want to use the word scary, but a little off-putting to access services.
How can schools in rural areas contribute to the identification and support for mental health issues at young ages?
One of the things that I really commend, I think the schools have done great things, especially in rural communities, certainly do a lot more. I would say that probably within the last 10 to 15 years, really you're, by having kids in preschools, we're really being able to identify when their kids are really starting to struggle with impulse control disorders and ADHDs. Identify that a lot quicker when they're in those settings, a lot quicker. Also, being able to have your kindergarten teachers and therapists in the schools. And I know that there's a lot of schools that are really moving in that direction, having better availability to school psychologists, therapists that can go into the schools and identify and do those screeners for younger kids, either struggling with some impulse control concerns or anxieties, or struggling with some social concerns in their home environment.
We noticed that the conversation of mental health and agriculture has been getting talked about more. Do you have any tips on how to keep that conversation going?
Primary care providers to do. It's just a different title that those of us that work in mental health have. Interestingly, I did clinicals in Broken Bow, and I can remember doing a lot of mental health and psychiatry work there. In fact, like my instructor had me meeting with a psychiatric resident and a psychiatrist once a week to work up psychiatric cases I was seeing in the family practice setting. And I don't know how many times I heard patients say, I don't want to go see a psychiatrist. I'm not going to go see a psychiatrist or a psychiatric provider, but yet they were still expecting their primary care provider to do the exact same thing. So hopefully just that conversation of it's not that different. It's not that scary, but you're seeing somebody who specializes in those medications, in that treatment, those treatment modalities that can maybe help identify and access services a little bit better.
Thank you for your work, Jessica. The more we work on projects like these, the more we see how big of a deal this is. Thank you for connecting Bassett to rural mental health services.
Oh, well, thanks for reaching out to me.